Hi, my name is Glenda and I'm a registered nurse. I work in a hospital and I wanted to inform you a little bit about MRSA. Some of the questions that I'll be asking and hopefully will give you information to clear up what MRSA is what do the letters stand for? And is there any antibiotics for MRSA? Is this a bacteria that's just found in the hospital? Also, how is MRSA spread? And last, what can you do to prevent the spread and avoid getting this bacteria? MRSA stands for methicillin-resistant Staph aureus. Staphylococcus aureus, often called staph, is a bacteria that's carried on our skin. It's also in the nose of healthy people. About 25 to 30% of people are colonized with staph, and what that means is the bacteria is present, but that it is not causing any problem and is not causing any infection. When an infection occurs, antibiotic therapy is started, and this bacteria becomes resistant to the commonly used antibiotics. They are called penicillin-like antibiotics. When the resistance occurs, that is when Staph aureus becomes methicillin-resistant Staph aureus, and MRSA is now what we call that particular staph infection. There are antibiotics to treat MRSA. A common one is vancomycin, and the penicillin-like antibiotic that has been treated staph before no longer is helpful, so we will just go with the vancomycin for our therapy. Is MRSA only found in hospitals? MRSA used to be found in hospitals, but now there are many people with MRSA who have never been in the hospital, and so this particular type of MRSA is called CA-MRSA, or community-associated MRSA. We're not sure why some people get MRSA and others don't. Studies suggest that since MRSA is not universal, susceptibility factors are possible. Immunity resistance could be lower in some people. And how is it spread? We know MRSA is spread by touching skin from another person, especially if they have an active lesion. Also, it is spread by touching items that we're in contact with someone's skin, like at the gym, sports equipment, or public handrails, ATMs, anywhere that there's a chance for physical contact. In the hospital, patients are isolated that have MRSA. If you are visiting, you should wear a gown like the healthcare workers are wearing. There's been active surveillance programs in hospitals to attempt to control MRSA transmission, and you will see medical staff using disposable medical equipment, a one-time use, in attempts to stop this transmission of this infectious disease. The use of rapid screening of blood testing helps us lead to earlier isolations of patients that are at risk for MRSA. And last of all, what is your role in preventing the spread of MRSA? You can prevent the spread by hand washing techniques and try to use an alcohol-based hand sanitizer. Studies conducted using microbial hand sanitizer versus the alcohol hand sanitizer has found that all alcohol-based hand sanitizers definitely decrease MRSA strains within 15 seconds. And you can prevent the spread of MRSA as well as any other bacteria by being proactive. Cover any skin lesions with a clean, dry dressing. Do not share personal items like towels, razors, clothing, equipment. Clean surfaces at the gym or places that you share equipment. Always clean with a sanitizer that is available. And last, take a soapy shower after working out or playing any type of sports where there's been skin contact. Last and most important is always use an alcohol-based hand sanitizer for about 15 seconds. And when you suspect an infection involving MRSA, always involve your physician for medical advice. Do not wait for it to worsen. And I hope this has cleared up any questions that you may have had with MRSA, and I hope you understand a little bit more about MRSA and your preventative role in stopping the spread of this highly contagious bacteria. Thank you so much for your time.